Hey everyone, welcome to the front row with Ed, and this is Elizabeth. I have a patient of mine that's a caregiver for her husband, and so she asked me to make, or asked us to make some videos for her that might help her and other people too that might be caring for someone. So in this video, we're going to talk about basically how to help someone transfer from the floor to a couch. A couple things to look for to first of all see if they're safe to transfer, and also cueing as a caregiver to hopefully prevent any injury for them. And so let's get right into it. So Elizabeth, what are some of the things that we would look for? So let's say you came across your partner and they were on the ground. What are some of the things that we need to look for to make sure before we transfer them?
So I would say we need to talk about asking questions about their vision, asking if they hit their head, asking if anything hurts. You even asking if they think anything is broken. Like really just get very clear and direct with the questions.
Excellent point. And then also too, I would imagine if there's just an obvious any signs of blood, I mean, if you saw them go down, then it gives you more information about the scenario as well too.
Right.
And if there's any doubt, if there's any confusion, definitely call 911.
Yeah, and it kind of depends on what their level of functioning is prior to the fall, and then comparing that to their awareness and their ability to communicate after the fall. You're kind of gathering all that information to make a good decision about moving.
Because to get up off the floor, in this situation, I'll be the patient and I have to be ambulatory and able to walk a little bit prior to the fall. Because if I wasn't, then chances of me being able to get up are pretty slim, and then I'm going to put you at risk, which I don't want to do.
Yeah, exactly. And the thing about this is this is geared towards caregivers making good decisions for their body. And we're talking about maybe minimal assist, which is anything from 0 to 25% effort by the caregiver to help their loved one off the floor. Any more than that, and you're getting into dicey zone where you might be compromising your back, your balance, and the safety of your loved one as well. So we get into that place where we have to be pulling in lots of different decision making, and that's why we're going to do this. We're just going to go through just a few of the scenarios that could be to help you go, okay, what would I do in this situation? Because the thing is you really want to be thinking about this before there's an emergency situation. Working in home health for years, we try to educate caregivers and patients about how this might go down. And people don't really want to get on the floor. People with Parkinson's or who feel compromised, they don't really want to get on the floor and try to get up. But it's a really good idea because it tells you where you're at functioning, it tells you about your strength, it tells you about the balance, and what you might expect if there was a fall. What's the likelihood that you're going to be able to help your loved one, that your loved one is going to be able to help get themselves off the floor?
So what you're saying too is that maybe you should almost practice this.
You should practice this.
Okay, I'm ready to practice. Let's do it.
Okay, let's go. Okay, so in this scenario, I've come upon my loved one, and he's alert even though...
What happened? What happened?
So you would start asking questions and you'd say, hey, what happened? Looks like you took a fall.
I was just standing and then I think I tripped over the dog.
Okay, so the fact that there's something that they tripped over is important because we want to be knowing what their level of coherence was. So maybe it's a blood pressure issue, maybe it's a blood sugar issue. So that's a really good piece of information that there was a mechanism for the fall. Right? So that's one thing. So now we've got a mechanism. Do you hurt anywhere?
I don't think so. I think I'm okay.
It was a little bit stiff.
Yeah, I think I'm okay.
Did you bump your head?
No, I didn't bump my head. I just kind of fell down on my hip.
Okay.
But I think it's okay.
Okay. Do you feel like you can move your body without compromising or without hurting?
Let me check a little bit here. I think I can move my legs. I can move my arms. I can move my head.
Okay.
I think I got lucky, honey. I think I dodged a bullet.
Okay, good. So at this point, you're like, okay, we're feeling pretty good about his ability to be able to help in this scenario, for him to participate. I'm feeling like, well, prior to the fall, I was helping him, maybe minimal assist. Remember, I said that's anywhere from 0 to 25% assist by me to help him do transfers, sit to stand, could be the shower transfers, toilet transfers, chair transfers out here, in from a soft couch. And I'm thinking there's a pretty good chance that we could proceed. Bend your knees and let's get you to roll to your side.
Which side do you want me to roll?
And you're going to roll towards the couch. And you're going to want to be as close to a very, very stable piece of furniture. So it could be the couch, it could be another soft chair. Something like a hard chair is not a great idea, and a rocking chair, those are not great ideas. So you might have to have, the person who's fallen might have to crawl to the most stable chair. And we'll show you that in a minute. But I wanted to mention that you're going to want to move towards a stable piece of furniture. Okay, so now go ahead and get up on your hands and knees.
I need a little help.
Okay, so go ahead and roll. Good. And bend your knees. Good. Good. And so it might be messy and awkward, and just take it slow. There's no rush when you're trying to get up off the floor. Okay, so put the left hand up here on the couch, and then see if you can lift your bottom up slowly. Kind of inch toward the couch, lift your bottom up, put up one leg, and then just sliding over onto the couch. Now, it might even not, that wasn't super smooth, but it might not even look that smooth, and that's okay.
And it helps too when you have your strong leg closest to the couch. So in this situation here, my left leg is my stronger leg, so I brought that up so I could kind of push off of that a little bit. And the nice thing is I don't have to even go all the way to a stand. I can go from here just enough to kind of clear and get that over. Now, what happens if we have a client that can't crawl? Any ideas?
Okay, so, right, if you're in the middle of the floor, one way to get to that stable piece of furniture is to crawl. But another way, if they can't get up here on their hands and knees, is for them to get up onto their bottom. So as long as they can push up with their arms, and they may need a little bit of help, this is where, we can try to get the stable part of their body, not grabbing an arm. It might help to get their feet flat, or they might want to just push on their heels and use their arms, the strength in the arms and their hands.
And it depends. Like I had a patient that had surgery on his knee and he wasn't able to bend the knee.
Right.
And so if you have legs, you obviously want to use your legs. Or if you have legs that work, you want to use your legs. But if not, just scooting yourself back.
Right.
Once again, to a stable piece of furniture then. And then it doesn't look pretty, but sometimes what you can do is you can come up to here and kind of wiggle your way up with your arms and slide over, and then you're on the couch. And then you can roll, and with a little bit of help, maybe you can come to sitting.
Right. And again, little, 0 to 25%, maybe a little bit more. It's awkward to try and help move a body, right? And so we want you to stay safe. We want no arms being pulled, no backs being strained. And
because you've worked with both the client and the caregiver after they've hurt themselves, right?
Yeah, exactly. And it really creates, people lose their ability to do their everyday life. And yeah, you want to take risks like that.
Yeah, that's a good point. At the end of this video, I will put a link to another video that we did that covers 5 basic exercises, because the stronger you can get going into it, and like we said earlier, just practicing getting up and down off the floor when you're not in a crisis situation, I think can be really helpful. And then as well as trying to get as strong as you can, not only as the client, but also as the caregiver as well too, because all of us should be on a balance and strengthening program as well.
Yeah, and you can count the transferring practices as exercise, because it will tax you. It's good. I mean, it's good functional strengthening is what it is. Now, you may not want to get down there every single day and get up, try to get up off the floor, but you want to do a check-in, like, let's see functionally, how am I doing getting up and off the floor? That was one of the things when I worked in home health. The clients would need to, in order for us to discharge them, they would have to perform that and get up and off the floor, and we would just document how much help we would give them. Of course, a lot of this was instructing the caregiver in how to help them or how to verbally cue them.
Absolutely. All right, make sure you check out the link for the exercises that we should all be doing at the end of this video. If you have any questions for us, please leave it down below, and we hope the video was helpful, and good luck.